Michelle, it's great to have you here at the Nuffield Trust Annual Health Policy Summit. And I've got some questions I'd like to put to you about the whole issue of how the voluntary sector can work with the NHS in trying to improve services for people.
Great.
So I wonder if, first of all, you could talk to me a bit about how do you actually see good care for people with long-term conditions such as multiple sclerosis? What would that care be like?
Well, people with multiple sclerosis and other long-term conditions are very clear about how the system isn't working and what they think good care is. So, firstly, they often say they have to be pushed around the system. There isn't a central person who can help coordinate their care, and they're often telling the same story to multiple professionals. That's frustrating, time-consuming, and they feel waste money. What they want to see and want to have often is one person who can help them navigate what can be a complex system so that they're getting the best clinical outcomes, but importantly getting the best care and support in their communities when they leave hospital, and getting the right information, advice and support to take control of their own condition and self-manage better. The second thing they say isn't working is really about support specifically for self-management. They often say they know their condition, they know what they're feeling much better than the clinicians and the specialist nurses, but they lack the information, the advice, perhaps the apps, the products, to really take control of their condition in a way that improves the quality of their lives.
Well, you clearly have a very strong sense and understanding of what it is that people with long-term conditions like MS want in terms of their care and how it's coordinated. How then do you, as an organisation representing patients, how do you work with the NHS to put that into practice, that approach to care?
Well, at multiple levels. I think part of what we do as an organisation is present a very clear evidence base, firstly about the access and the quality of care that people with MS are experiencing. And what we know is that access to care is very poor. It's one of the lowest levels in Europe. And the quality of care is incredibly variable. And this is a story that's common across the NHS and the social care sector for people with different conditions. So we have a role in presenting the evidence, but also a voice for those people to tell their stories and say what the experience is really like. Based on that evidence and our understanding of what works from our engagement, our consultation, our input from our people, advising commissioners about how to redesign and improve the services that they provide so that they drive up quality and reduce costs. And I think the third thing is consistently reminding the NHS that people need to be at the heart of decision making, co-designing and co-producing the services and support that they need to drive up the quality of life that they're experiencing.
I mean, you talk about the need to work with commissioners to bring about the change that you and the patients you represent are seeking.
Yes.
Do you do that working at a national level with, say, NHS England, or do you feel it's more important to be working with the local clinical commissioning groups to do that?
Well, one of the perspectives representing a patient group is that it's a very complex system at the moment, and it is one that is bedding down. And sometimes, if you're not an expert within the NHS, it is hard to understand who has power and what the levers for change are. So what we try to do is work across all levels within the NHS and try and pinpoint those people who have the most power to make the biggest difference. So we do work with NHS England at a national level, but also we work locally with clinical commissioning groups, local authorities, to get them to understand the services that they're providing and also to redesign and improve them based on the experience that we have. So we find it's important to have that national and local, but also to pinpoint those points in the system which will deliver the biggest change for many people and patients. And we are undoubtedly aware that there needs to be not incremental change, but absolutely transformational change in the way in which people are involved, engaged, co-producing services, and a transformation of the NHS, I believe, will only come about if patients are much more involved.
My final question was going to be, actually, if there was just one thing that you could change in the NHS on behalf of the patients you represent in the MS Society, what would it be?
Well, I think people with MS tell us the thing that they value hugely is MS nurses. And what they provide in the current system is that crucial point of coordination, often referring to neurologists, often ensuring that the community and social care services are wrapped up well together. And what we're seeing is a real squeeze on MS nurses throughout the country, and that's proving very problematic and having a big impact on access and quality of care and support, which we know isn't good at all for people with MS as a general trend.
Well, thank you very much, Michelle, for sharing your thoughts about ways in which the voluntary sector can work with the NHS to improve care.
Thank you.